Hello everybody, welcome to the third last lecture of Unit 1, during which I will stress the importance of religion in healthcare. So we move from culture to religion. And here we go, we start with a graphical presentation of dominant religions. Please study it in your free time. Right now I just want you to see, which is obvious I think for everybody, that in a global terms, in global perspective, we see that there are many different dominant religions in different regions. Yeah, so this presentation, this graphical presentation, just gives you the sense of these differences. So we have Christians, Muslims, Hindus, Buddhists, Jews, non-affiliated, but of course there is like much more religions than only this majority religions presented here. Of course, when speaking about religion, one has to provide definition. And of course, there are many definitions of religion. Here, we would like to provide one that we find quite helpful, for our further discussions of the role of religion in healthcare. So let's understand religion as a system of beliefs and practices that defines the relationship between the variously conceived sphere of the sacred and the divine in a society, group, or individual. So religion manifests itself in the doctrinal dimension, such as doctrine, beliefs, in religious activities such as worship, rituals, and in the social and organizational sphere, such as religious communities, etc., but is also present in the sphere of individual spirituality. In 2012, 59% of people consider themselves religious, 23 did not, and 13 declared atheism. According to various estimates, there are between 4 to 10,000 religions worldwide. I focus your attention also to non-affiliated, non-believers, which will be also important part of our lectures. So it's also important to differentiate religion from religiousness, and there we can approach it from two different directions. For instance, in Christian theology, religiousness is a moral virtue that consists in showing due honor to God through internal worship and external worship. But it is more important to us in psychology and sociology of religion. Religiousness is attitude of a person of social group towards the dogmas, precepts, and customs of a given religion, which is manifested through the assimilation of these principles, their acceptance, and conformity of them. So religiousness, how we practice religion, or how does religion work? How does religion work? So our module, Managing Religious Diversity, provides a general overview and a starting point for discussing the rules that apply to followers of different religions. But what is of high vital importance is to remember and to keep in mind that there is no typical representative of a religion and, of course, of culture, and that rules of a religion may not be strictly observed by its adherents and representatives. For example, due to processes of globalization, migration, acculturation, integration, assimilation, but also due to individual choices. So we will present, in what follows, lecture that follows, we will present the ideal type. So, religion and health, religion and healthcare. Why is religion important in healthcare? So religion is an important factor in most patients seeking care, especially for oncology, psychiatry, cardiology, or for the elderly. Unfortunately, healthcare professionals may not take religious beliefs into account when dealing with difficult medical decisions for patients and their families. Throughout human history, religious leaders were also closely associated with healing. Only in recent years, medicine has adopted a scientific approach, leading to the separation of religion and medicine. The challenge for healthcare professionals is to understand that patients often turn of their cultural, religious, and spiritual beliefs when making medical decisions. So this is the part of the lived life. This is the part of the religion making, and we need to treat it seriously. So, religion can influence decisions on many aspects that are related to health. For instance, diet, medication based on animal products, modesty, preferred gender of caregivers, touch, the process of diagnosis and treatment, birth and death, etc., etc. Some religions have specific prayer times that may interfere with treatment. Healthcare professionals should respect the religious needs of patients. Also, many patients' anxieties are reduced when they turn to their faith during health care challenges. Apart from its obvious clinical aspect, healthcare has moral, philosophical, psychological, as well as religious, cultural, and spiritual dimensions. Participation in various religious practices, such as prayer and one's own individual perception of religiosity, can contribute to an increasing sense of life purpose, inner peace, and heightened awareness of social support. This can result in a positively altered health behaviors and therefore better psychological and mental health. Religion viewed in general has the following functions. This is like a worldview explaining phenomena difficult to understand, educational, implementing a system of prohibition and orders. It is also a political ideological dimension shaping behavior according to religious principles and creating social orders. It has also to do with culture and aesthetics, of course. Considered in a medical context and the impact on the patient, it has the following functions. It can have supportive therapeutic function. It can help explaining and allowing to understand difficult concepts for human beings such as death, suffering, illness. It has also normative and controlling dimensions, defining the ethical framework of patient care and caring charitable. Of course, religion and religiosity may have both positive and negative effects on health and disease. Let me just now shortly develop both of them. So, starting from positive effects. So, numerous reports show that faith can have a significant positive impact on the understanding of concepts such as health and illness, as well as on responses to illnesses, perception of the human body, attitudes toward pain, and the patient's own care for his or her health. Patients with higher level of religiosity have been found to have a lower prevalence of negative stress symptoms, lower levels of anxiety, and less frequent disorders, personality, or depression. As contemporary research shows, higher religiosity is related to patients' resilience to stress, influences their optimism, and positive life energy. Religiosity helps to produce positive health behaviors, which can include following medical advice, such as diet, reducing or avoiding substance abuse, such as alcohol, or not engaging in risky sexual behavior. In groups with higher level of religiosity who regularly engage in religious practices, the risk of cardiovascular disease, including hypertension or other, is reduced. There is emerging research suggesting that religiosity may correlate with a person's life expectancy. It appears that people who are highly religious have a higher chance to of survival compared to less religious people. Interestingly, people with disability mostly belong to the group of frequent practitioners. Religious involvement has been shown in many studies to be a significant factor in reducing psychotic anxiety, tendency to suicidal thoughts, and suicide as such. Of course, there is much more to these positive effects. Let's jump to negative one, because there are also some. Because it is also important to mention reports suggesting a negative impact of religiosity on health. For instance, religious belief may sometimes influence the avoidance or cessation of conventional treatment, the avoidance of some effective health-promoting interventions, or to neglect of periodic checkups. Sometimes people with strong religiosity have unrealistically high expectations and demand of themselves, leading to isolation, stress, anxiety, or alienation from a group. Be aware of be aware of religious groups, especially those of a sectarian nature, which can promote unhealthy forms of worship and a fanatical belief system, leading to a personality destruction. In some people, faith can induce feeling of guilty, cause emotional trauma, obesity, etc. For many patients, the spiritual crisis is a bigger problem than a symptom of underlying and finishing this last lecture, I just would like to stress that religion is also a source of intercultural conflicts, but it also is a challenge and a source of support for immigrants. So we can also think about religion and culture interactions in this broader perspective. Thank you for listening. Lecture number 3 from Unit 1. See you later.